Want help surviving with POTS? Then you're in the right place. In this video, I'm going to go over 4 things that make living with POTS more manageable, and some of my personal knowledge and experience with each. So let's get into it. Number 1, take your medication and push back against the use of certain medications when necessary. Whether you are on midodrine to increase your blood pressure or propranolol to decrease adrenaline spikes, you should try your best to take it as directed and discuss medication issues with your doctor when negative circumstances arise. And please be honest with your doctors when something isn't working. For example, I used to be on a high dose of a beta blocker to help with my adrenaline spikes due to having hyperadrenergics, the hyperadrenergic subvariant of POTS. There's just one major problem with this, and that is that I have a naturally low resting heart rate from being physically active. The lowest I have recorded my heart rate naturally, without drug intervention, was a stable 38 beats per minute. When I was placed on the beta blocker, my heart rate dropped to between 5 and 25 beats per minute. In reaction to this, my body essentially fought the beta blocker and tried to flood my body with even more adrenaline and stress hormones, which obviously did not work. This resulted in me having what doctors referred to as pseudo seizures. For the sake of clarity, pseudo seizures were not my pseudo seizures were not neurological in any way and are not the same as someone with epilepsy. This is an important distinction because the hospital I was admitted to placed me in the pediatric neurological unit rather than the cardiac unit. Funny enough, despite having been diagnosed with POTS and all of the information I am telling you now being known to everyone in the unit, one of the doctors was convinced I was just being dramatic or had anxiety, with a heart rate of 5 to 25 beats per minute. I should clarify through all of this, I was struggling to stay lucid. I frequently was saying nonsense and couldn't think through some of the most basic of problems. Eventually, they agreed to decrease the dose of the beta blocker that I was on. Originally, they were very resistant to this concept, and following the lowering of the dose, my heart rate increased, as did my lucidity and general awareness. So it is paramount for you to keep in mind that physicians aren't always correct, and that it is up to you to advocate for yourself when a medication isn't working or is clearly doing more harm than good. For me, I now know to getting ahead of the drop in blood pressure. For me, I now know that getting ahead of the drop in blood pressure by modulating my blood viscosity with meds or other things helps to prevent the need for blocking adrenaline altogether. All right, tip number 2. It is to get ahead of it. This is obviously not applicable to everybody, but is something that I have used to learn to my advantage, or I've learned to use to my advantage. A few ways I have gotten ahead of things in the past, and this is once a flare up of POTS has presented itself, so I'm not omniscient. Sometimes I don't know when they're happening, but a few of them are the following: having a chosen electrolyte mix next to my bed so that when I wake up first thing in the morning, I know to do the first thing I need to do is drink it. Keeping a pair of compression clothing, compression socks, pants, shirts, whatever, and my cue collar next to my bed so that I don't have to try to get up and walk to the closet to gather these items. Next is keeping a cane with me if the flare up is bad enough, either next to me in bed or next to my desk. I actually have one next to my desk right now, or even near me at the gym. So when I inevitably do get a blood pressure nosedive, I am less inclined to fall and hurt myself. Choosing exercises in the gym that I am less likely to get, or at home, that I am less likely to get injured from if I faint during the exercise. So this is something that I utilize when I'm having really bad POTS, such as laying on the ground of core exercises like leg raises. This way, I don't hit my head if I faint because I don't want to get another concussion. And also, I should clarify, sometimes you don't fully faint, sometimes you partially faint, sometimes it's just you collapse. And if you're doing something laying down for exercise, it's often a lot less bad in terms of injury. Standing with your legs crossed and tensed if you are going to be standing for a long time is also helpful, even before symptoms present themselves. I frequently make the mistake of just standing normal when I'm standing in a line, like maybe I'm waiting at the pharmacy or to pick up some food. But I often have to remind myself to cross my legs and tense my calves and tense all my lower body muscles to try and push blood up towards my torso. Lastly, in terms of this smaller list of things of getting ahead of it, are having a blood pressure and heart rate monitor to keep tabs on your metrics. I personally have an Apple Watch and I have a blood pressure cuff. In order to adjust, this is in order to help you adjust your needs throughout the day. For example, if you notice that your heart rate is spiking and is higher than average, and your blood pressure is below what you and your doctor have deemed acceptable, you know to increase your fluids and electrolytes earlier rather than to wait until the fainting spells manifest. All right, tip number 3 for surviving with POTS. This next tip is unfortunately not helpful for a lot of us, but it is a really fun one to learn about, so I wanted to talk about it, and that is service animals. Many people have service animals for a variety of conditions, and obviously a lot of people with POTS have service animals, and service animals can be profoundly helpful. Let's use the example of dogs. A few ways dogs can help are detecting adrenaline floods, alerting you of an accelerated heart rate, being a balance point for you to hold on to when you are walking or standing, opening certain types of doors. I clarify this because some doors are push to open, some doors have twisted handles, but if it's, a standard circular doorknob, I don't know if they're going to be able to open that. Giving you a sensory point to lock onto when you may be experiencing overwhelm of sights, sounds, or smells. So I know for a lot of people with POTS, including myself, when you are in a very loud environment, like a concert or I go to hockey games sometimes, and I get really overwhelmed. And sometimes it's helpful because to just have one thing to lock onto. It's also a tip that helps with a lot of people with anxiety, but it helps a lot to try and focus your brain on one specific thing to kind of try and hone in all of the excitatory information that's coming into your brain. Um, Another thing is that service animals can provide deep pressure stimulation by laying down on your legs when you are seated, and this helps to force blood back up to the brain and torso. Another way they help is alarm barking, or finding help if you lose consciousness and do not regain it within short order, that is, or become injured when losing consciousness. If your dog is trained to alert when you have fainted, and maybe perhaps you fainted, maybe you trained him that after a certain amount of time, once you fainted, barking or go looking for someone, this can help so that you're not at a long-term risk for, not getting medical intervention when you need it. Um, the other thing that dogs and service animals help with is improving a sense of independence by allowing you to accomplish more things on your own. It's not all sunshine and rainbow of dogs, though. I've heard a lot of people who do have POTS that have service animals have sometimes a hard time doing it on a day to day basis and really only use the dogs when they're absolutely necessary. But I've never had a service animal. All I have done is I have a St. Bernard and I trained him to lay down on my legs to help with deep pressure therapy. That's about as much as I know about that, though, in terms of personal experience. And number 4 for POTS survival tips is seeking accommodations when you're for your work or for school. I am lucky enough to work in a field where I work remote 3 days out of the week, and the days that I go into the office, I have someone drive me. This is what's known as a reasonable accommodation. If my work required me to be in person all week, for example, if I was a cashier at a clothing store, I wouldn't have this option. But I could ask for another accommodation, like having a stool provided to me while I work so that when I'm at the cash register, I don't have to stand the entire time. It is important to remember that these only apply to what's called reasonable accommodations. If you do not have the capacity to work the scope of a position, most employers are technically within their rights to terminate your employment. And if you're considering living off of disability provided by the government, please note that most people are rejected, Also, due to a fundamental misunderstanding of how POTS manifests, someone like myself, even if I was having a really bad POTS flare up for years at a time, would be highly unlikely to ever get approved. One metric that I hear a lot of people have problems with is if you are capable to lift over a certain amount of weight. Usually it's like 50 pounds. And in my case, if I were to apply for disability, I would have to tell them the truth. I am more than capable of lifting over 50 pounds. But to explain that to a government employee, explaining to a government employee that I have POTS, and some days I might be great, and other days, if I'm having a bad flare up, I might struggle to even crawl to the kitchen, doesn't often make a lot of logical sense to people who are not in the medical field or otherwise are trying to look out for people who are scamming the system, so to speak. A lot of people get rejected from disability. They want a consistent disability, like a missing limb. So it's not impossible to get disability payments to help you live when you have POTS, but from everything I know, it's extremely difficult. I hope you guys found these tips helpful. And if you know someone in your life that suffers from POTS, or perhaps you have POTS and want to explain to a family member what things can help you on a day to day, please share the video with them. If you have POTS and want to share a little bit about your experiences, feel free to leave a comment below. Um, Please also like and follow me for similar videos. And until next time, lift heavy and keep on living.